Hi there, I'm Allison, Marketing Director with Randall Mill Pharmacy.
And I'm Patrick. I'm the pharmacist in charge at Randall Mill Pharmacy.
Hi Patrick, let's continue our discussion about raising awareness on heart health. Today we're going to go more in depth about heart attack and stroke symptoms. Patrick, can you tell me what a heart attack is?
Yes, a heart attack is whenever blood flow that brings oxygen to your heart gets severely reduced or even stopped. And one of the ways that happens is cholesterol can build up in your blood vessels and can narrow the artery, which reduces blood flow or can even block it completely. Another way that happens is when cholesterol builds up, it can form a plaque on the artery wall, and if a piece of that plaque breaks free, it can form a blood clot, which can also block blood flow to your heart. Now, I do want to take a couple seconds here to just say, if you've had a heart attack before, you can definitely recover from a heart attack. Your heart may be damaged based on the severity of the heart attack, but typically speaking, a heart can recover within 8 weeks. And through rehab and physical exercise, you can regain a lot of the activity you used to do before your heart attack.
That's great. Are there any warning signs of a heart attack that I need to be made aware of?
Yeah, so most people think of chest pain and shortness of breath, and those are the two most common signs of a heart attack. But you can also have arm pain, back pain, and even jaw pain. And there is a difference between genders when it comes to presentation of a heart attack. So most men will get your typical chest pain, shortness of breath. Women, on the other hand, they do still get chest pain, but they may present with jaw pain and with back pain. And you can see in this graphic here that there are many different ways that a heart attack can present.
We learned in our previous video that high blood pressure can cause many physical issues such as a heart attack and stroke. Can you explain to me what a stroke is and how to spot warning signs?
Yes, I can. So similar to a heart attack, a stroke occurs whenever blood vessels leading to your brain get blocked or the blood flow is reduced. And again, the same things can cause issues. Cholesterol can narrow the arteries or even block a blood vessel completely. One small difference though when it comes to a stroke is a blood vessel can actually rupture, again due to high blood pressure and the constant pressure on your blood vessel. And so a ruptured blood vessel can also cause a stroke. So if you want to try and spot the warning signs of a stroke, remember the word FAST. F-A-S-T. FAST stands for facial drooping, arm weakness, slurred speech, and it's time to call 911. So if someone you know is having a stroke or you think that they're having a stroke, you want to look for one half of their face to be drooping. You want to ask them to raise their arms, and if one arm can't be raised all the way or is lower than the other, that's another warning sign. If you ask them to repeat a simple sentence and their speech is slurred or they can't repeat that sentence, that's another sign. If you notice any of these, it doesn't have to be all three, just one of them, you would immediately call 911.
That's an easy way to remember it. F-A-S-T. Are there any preventative tips to help lower my risk for heart attack and stroke?
Yes, so to help prevent heart attack and stroke, you would want to maintain your blood pressure at the ideal range of less than 120 over less than 80. Control your cholesterol. Make sure you have a healthy diet, again, that's low in salt. You want to make sure that you're physically active, so 30 minutes of exercise per day or 150 minutes per week. And also, if your doctor has prescribed any medications for you, be sure to take them as your doctor has directed, and usually that's every day.
I'll be sure to maintain a heart-healthy lifestyle to avoid the risk of a heart attack and stroke.
If you'd like to learn more information about our topic today in this video, you can visit the American Heart Association's website at www.aha.org.
We appreciate you watching our two-part video over heart health. If you like what you see, like and subscribe to our monthly videos. You can follow Randall Mill Pharmacy on Facebook, Instagram, and YouTube. Links are shown below.